Hi friends, I have the pleasure of introducing to you Dr. Kshitij Gyanraj, rank 11, May AIIMS 2018. He has a rank 47 in this PGI exam as well. Heartiest congratulations.
Thank
We
you,
are
sir.
very proud of your achievement. At the entire DAMS family, you have been a test and discussion student with us.
Yes,
We
sir.
are like so proud of your achievement. Heartiest congratulations.
Thank you, sir. Thank you.
So let me convey this congratulations to your parents as well. Maybe
Thank
for them also it's a splendid achievement. I think you have done very well.
Yes, sir. My parents were also quite supportive.
Definitely they should they would have been, because to do such a splendid act that you have, these are both central institutes of excellence, and you've done well in both of them. Awesome.
Thanks.
So how are you feeling?
So I'm feeling great.
Has the feeling sunk in that your journey of preparation is over?
Yeah.
The journey towards the post-graduation is beginning?
Yes, sir.
Yes.
Before the exams, it was a very frustrating moment, but now I'm feeling very relieved.
Yes.
Very relieved.
Totally relaxed?
Yeah. In
Yes.
peace.
In peace. That's the right word, I think. Now the peace has come back. At least because you can get the branch of your choice. I'm sure in AIIMS you would be looking at the branch of your choice. So how was your experience with the test and discussion program?
So the questions are very well framed, and what I used to do is I used to read the subject for 3 days before the test, then give the test, and after that I used to analyze how did I perform after reading it, and then what I used to do is then go back and read it again. So that's a revision what I used to do.
So your idea was to finish your course, give the test, look at your mistakes, then revise.
Then revise again.
That's actually a very good strategy to do, so that you don't miss out on anything, and that multiple reading helps you to keep it in memory as well.
Yes. Yes.
And any particular teachers or discussions that you recall today that were of particular help?
Dr. Diksha ma'am's pathology was really good, and the subject, she taught the subject very conceptually, which helped me in the exam. And Dr. Siddharth's community medicine was also really good.
And these are very important subjects for AIIMS perspective as well.
Yes.
Yes. And did you utilize the previous AIIMS questions that we had put out on the ebooks app for you to utilize?
Yeah, the app was very handy, and which helped me in going through the solutions very quickly. Like the solutions were also very crispy, so it really helped me.
Yeah. So our vision is that we in India, there is a big need that the guidebook authors, they trim their explanations and reduce the size of the book for 3 volumes to 1 volumes. They need to trim it, because they've kind of increased the volume so much that you sometimes average student might actually miss out the message in reading 3 pages. They need to trim out. That is my attempt here. And I also want to ask you your experience with the Facebook group and the discussions with the faculties and the updates.
Yeah, the Facebook group helped me, like when I used to log into Facebook at night while going to sleep, I used to go through a few of the questions that were posted in the group, and that helped me. Like it is like I'm using the Facebook as well as going through the questions.
It's just like studying in the break.
Yeah.
So were you happy with the way teachers were active, answering, putting updates, quizzes to play with you?
Yeah, they were quite approachable.
Yes. So did you feel that we are creating an ecosystem where the teachers are trying to act like a mentor, not like somebody superior?
Yeah.
So that is the entire vision behind NAMS. Now I also want to utilize this moment today to ask you about, like, you have done well in AIIMS, you've done well in PGI Chandigarh, which are like apex institute that people dream about reaching. So but both the exams have a very different style of paper. So can you help us by enlightening us on the AIIMS pattern first, that what was it that you felt was different in this AIIMS from previous AIIMS?
Okay.
And what are the high yield areas in AIIMS, and how to approach the paper in AIIMS?
Like, the AIIMS questions are either they are very practical questions, or they are mostly on updates. So those are the 2 areas which the students should focus on: the practical areas and the updates. Like going through the first year physiology, biochemistry practicals, the urine examination, all that helps. Going to the wards also helps, because a lot of they are asking a lot of photos and pictures. That also, this time the pictures were reduced, but still the pictures are coming.
The pictures were there, but I think the number was slightly lesser than the classic 2-3 year pattern. Yeah.
And then sometimes what happens is in AIIMS, out of the options we can pick out the option what is the answer, because the answers are usually very either the eccentric ones. So so you need to solve a lot of questions, the previous year AIIMS questions, so we get an idea, okay, what could be the answer.
Just to maybe say that in a different way, maybe to keep that common sense.
Yeah, common sense. Common sense plays a big role
in AIIMS.
In AIIMS exam.
Yes. How many did you attempt in AIIMS?
194 questions.
194 was your attempting. And I think it is a good idea to be more aggressive in an exam like AIIMS, where the number of seats is so less.
Yes. It's like either you get the seat or if you or you don't get the seat. So
even if you get a rank 500, you're nowhere. It's better to get a 10 or 11.
To get.
Yes. It was a great actually thing. And what about PGI? How does that differ?
PGI has multiple. We have to select multiple options. So that requires more of a theoretical knowledge, more of like reading all the topics, doing all the previous year questions. So and a lot of questions, some like around 15-20 questions get repeated. Not much, but the topics get repeated a lot. So you have to go through the questions and the topics as well.
Yes. So I feel the difference between the approach in AIIMS and PGI is that in PGI the negative marking would also be higher.
Yeah.
So you are more guarded. That common sense with guard will add. We have to be little bit more guarded to apply that common sense.
Like
how many choices did you attempt in that PGI thing?
PGI, I used to play very defensive.
Yes.
Like it's like a test match where you have to attempt like if you're sure you should go for it, but mostly you should attempt 2 or 3 options, something like that.
So with that average, maybe you did around 500?
Yeah, around 500. Yeah, it's around 500 to 600 is the ideal number to attempt. If you attempt more, you are going to get negative.
And attempt 2 less, maybe you...
Maybe.
500 to 600 is a good number. And I've seen that most of the rankers have done this year the similar number of attempts in PGI Chandigarh. So that kind of gives you the idea on the different approaches that 2 central institutes are having. One is more... theory intensive, one is more practical intensive, maybe we can use that word here. And I also want you to now play the crystal ball, and maybe if you can guess some topics for the November AIIMS that you might think they might ask in AIIMS.
Yeah, like
topics like precise
topics. Yeah, the emergencies they ask,
yes.
Like medical emergencies they usually ask. Trauma is a
yes.
Yes, trauma is a yes. Then in microbiology, they could ask something. They have asked rotavirus this time. So virology and fungi are really important for AIIMS.
And plus, what I feel is that this time they've touched upon a new drug as well, which was slightly atypical for them to do usually. So maybe new drugs.
Yeah, new drugs. New drug. The updates is always in the AIIMS.
Yeah.
Like they ask a lot of guidelines also. RNTCP.
Yeah.
Gold guidelines, GINA guidelines, all this, helping, reading them will help.
Any particular topics that you feel are important from PGI perspective?
Surgery and ENT.
Because and ENT classically you missed for AIIMS.
AIIMS, yeah.
But I think PGI it has played, because I've seen most of the toppers have mentioned ENT for PGI.
PGI, yeah.
So what kind of topics do you think they were asking?
They ask surgeries. They ask a lot of questions from ENT, which you don't usually study for AIIMS.
Yeah, because in AIIMS the often ENT are nowadays being reduced to lesser questions, but you never know. The patterns are more dynamic. You never know. But these are good insights for a future aspirant. You know how to approach the paper, how to revise, and all. Now I'll ask you a question that there are 2 questions, 2 parts to my question here. One is that I want you to give a revision strategy for somebody who is starting today and wants to do well in November AIIMS. Okay. So what should be his landmark for revision? At what date should he start revision, or any idea that you can give him?
For AIIMS, you have to first analyze the pattern. That's the most important thing. You have to analyze what they are asking. Like reading everything would do no help, because we cannot remember everything. So analyzing the pattern should begin at first, and then one by one the individual should proceed. Like subject by subject, the first year subject first, then the second year, then the third year, and slowly it keeps building up. The connections start happening, so it keeps building up, and then like around 2 months for the first 2 to 3 months at their own pace. Doesn't need to be hurried up initially. So after 3 months, then the person could start revising it, and what the last week becomes really important. You could, like, if you have notes or something like that, it helps you in revising in a very quick time.
Yeah. So that is a approach right from the person who's done it, so well. He is now guiding you to look at how to do the November AIIMS in the next 5-6 months and how to plan it. And the idea here is that you have to draw a line, maybe 3 months, 4 months, draw a line, then do revision. Because if you don't revise, you will not feel the confidence.
Yeah, yeah.
You may remember, but the confidence will go.
Revision is a must.
Yeah.
Maybe 2 revisions, 3 revisions. It's better to have as many revisions as possible.
And now I'm asking the second part of the question is that I feel that success is in hard work, it is in strategy that you have told them about, but success also is in your mind. So you have to share your mind with us and tell us some motivation, that what keeps you motivated, and with that can you help others to be motivated for the next exam?
Yeah, sure. In November when I gave the exam, I got rank 322 and I had to take surgery at AIIMS. So I did work for like 2-3 weeks, but I didn't liked it. So what I did was I left the job and then started preparing. I had around 2 months to prepare for it. So it was a very challenging thing to do. There's always uncertainty. So but I somehow gathered some confidence and started studying. So slowly it again worked out. So it takes time, but you have to keep patience.
Plus, and I think the message that I get from your discussion, correct me if I'm wrong, is that if you're not happy doing something, you can move on and take a risk. Yeah, that is what you did, I think. Yeah, and it was not an easy thing to do.
Because it's for a lifetime. Whatever you take, it's for a lifetime. Yeah. So it's better to think and take, rather than what I did was I was getting something and
hurried into it.
Hurried into it, which was a mistake.
Yeah, but it's okay. In the end, now today you're rank 11 this year in AIIMS. Nothing is a mistake that you've done. Everything is now fitted into the story. But I feel that what I've learned from you is, and I feel that what future aspirants should learn from it is that it's very important to somewhere find out what you really want to do, so that you can channelize your energy onto it, and then you might take some risk also because you know really what you want. But some people don't know, and then they are not able to channelize so much energy into it. So with this, we conclude this interview with Dr. Kshitij Gyanraj. I am sure many of the students who have gotten a lot of topic insights and strategy insights from you, and I'm sure they will all benefit. From behalf of the entire DAMS family, I'm very, very proud of your achievement, and we wish you all the best for your future. Thank you.
Thank you.